We are recording. All right. So when we start off with the upper limbs of the appendicular skeleton, it's going to attach in two places. It's going to attach to the vertebra, although not directly via the scapula, which is what I've got here. And it's going to attach via the clavicle to the manubrium of the sternum, and that's a direct bone-to-bone attachment. So the scapula, while it does attach or articulate with the humerus, kind of like this, there is no direct connection to the vertebrae. It's just a series of muscles that anchor that in place. So this is part of why the pectoral girdle is not as strong structurally of a region as we see with like the pelvic girdle when we look at the hips. So with all of these bones, I like to look at or kind of like get a vibe on what is superior and inferior, what is medial and lateral, and what is anterior and posterior. That's like kind of how you identify and orient yourself as you move through these. So with the scapula, this proximal distal doesn't matter on this one because we haven't gotten actually into the appendage yet. So ignore those for now. But when I look at the scapula, the side that has these protrusions on it, and this is called the spine of the scapula right here, the side that has a protrusion on it, this is going to face posteriorly, so away out through the skin of your back. If you feel your shoulder, that ridge that you feel back up there, that is the spine of the scapula. And then if you follow that out, you get to the point of the shoulder, and that's the acromion or acromion process. You don't have to say process with it. So acromion, spine of the scapula. Below the spine, inferior to it, we have the so like infrared is below red, infraspinous fossa. And in this fossa, the infraspinatus muscle can be found. So when you learn these, if you can retain them through next term, it'll help you out with the muscle naming quite a bit. If we go back to that spine and go superior to it, we will have the supraspinous fossa with the supraspinatus muscle will show up in there too. And then you can kind of see here too, there's this little groove. That's called the suprascapular notch. Now, once I've found the spine, then I want to think, okay, well, this has got to touch or articulate with my humerus on one side, and then there's this just kind of long flat segment that muscles attached to on the other. So the humerus is going to fit in just like this, which means that like the acromion and this other process called the coracoid process, they face laterally. So I'm looking at a left scapula. So if you're looking at someone's back, this would be their left shoulder. Now, this space that region that the humerus articulates with right here, that's called the glenoid cavity. On the top of it is the supraglenoid tubercle, and on the bottom of it, or inferior part of it, is the infraglenoid tubercle. Coracoid process, acromion process. And then if we flip this over, so we're looking at the anterior surface. So now this would be like a person laying on the table, face up, and you're looking through their chest onto the scapula. This is the subscapular fossa, this big smooth area all over here. And that's about it for the scapula. We do have the borders. So we have the medial border because the vertebrae would be right here. We would then have the lateral and superior border there. So articulating with the scapula is the clavicle. And the clavicle joins it about like this, and then goes over the anterior aspect of the shoulder. So we don't have anything that we need to know on the clavicle specifically, but if you want to tell left or right, and I do use this as bonus questions on the practical, my left or right stuff. I won't ask on the quiz, it's just going to be identify the bone or identify the feature. But with the left or right, you want to find this kind of flatter end, the blade-like end. The chunkier end here, this is medial. The flatter end is lateral. And then this bump, the conoid tubercle, it faces inferiorly. So this one sits like this. Your neck fits in that curvature. And so this is a left clavicle. But again, we just need to identify the bone. What'll be on the quiz. So let me go back to the humerus and set this up. Now this will work with the proximal distal. So with the humerus, we're going to have kind of a ball-shaped end on the proximal side, and then the diaphysis leads to a flatter, almost like shovel-shaped end. This is the distal end of it. On either end, we will have articular surfaces. So that means that this bone is going to feel a little denser and a little more smooth because this should be covered in hyaline articular cartilage. We'll see that up on the anterior or the proximal end of this as well. So now I know which way is top and bottom, which way is proximal, which way is distal. I need to figure out which way is front and back. And if you feel your elbow, the point of your elbow, that's the olecranon process. It's on the ulna. But now if you extend your arm out, you can feel that kind of fit or slot into the humerus, the bone of the brachium. So it's got to fit into a hole. Otherwise, as I extended my arm, it would hit that bone. And so if I look at the distal end of the humerus, one side has two little fossas. The other side is going to have a larger fossa right here and a single one. So that large single fossa is what tells me this is the posterior aspect of the humerus. Now while you've got your hands by your elbow, feel the lateral and medial sides of it. Which side has a bigger bump, lateral or medial? Medial. So if I look at this bone, I see that there's one side that has a much bigger protrusion on this. So that's the medial side, and we call this the medial epicondyle. The epicondyles are basically the bony frameworks that support the articular surfaces, or condylar surfaces. Epi means above or around, and so we're in this kind of like above space. Another way to kind of figure out where these start and stop, if you just run your fingers down the shaft, they kind of naturally stop when it wedges out. So right when it wedges out, that's when you're in the epicondyle region. So now I know posterior, because this big olecranal fossa. I know medial is right here, and I know distal is also all on this edge, and so I can tell what bone this is. I am looking at the back of a left humerus, right here. On the anterior surface of it, it's going to have two smaller fossa. Those are going to be allowing for like either the radius or the ulna to kind of slot in here too. Now there's not nearly as big of protrusions on those bones, so it's not nearly as big of a fossa as our olecranon fossa. On the diapasus, we do have a little rough spot, so you can kind of hear that's smooth. You can hear the roughness of that, and that's the deltoid tuberosity. That roughness gives more grip for that muscle to insert into. Staying on the distal end down here real quick, I have a couple things in the head to talk about yet. We do have the articular spaces for our distal antebrachial bones. So on the medial side of this, and if you look at your forearm, going to your pinky on the medial part of your forearm is the ulna. So the ulna is going to articulate right here. Don't know, I think I did grab the right one. So it kind of slots in, and you can see how there is a little bit of a ridge in the ulna and a little bit of a groove in there. And so that helps kind of keep it in that space. The ulna also has on its hook the big point of the elbows. This is the olecranon process, and then the smaller trochlear process, or I'm sorry, coronoid process right here. The two together make the trochlea, which is that whole C-shaped curve. So when this is in here, that coronoid process will fit into the coronoid fossa and allows it to kind of flex a little bit more than it would otherwise. The trochlea itself keeps it locked in. And so the trochlear notch on the ulna matches with the trochlea on the humerus. This gets its name from a spool of thread, and they tend to look like, if you've watched old like Tom and Jerry cartoons or those old kind of 60s, 70s cartoons, mice will often like roll a spool of thread around. I think there was one in Cinderella too. And that's what it gets its name from though, is that old style wooden spool of thread. This rounded portion right here, this is called the capitulum, because the head of the humerus has a little kind of suction cup on it, look, and it fits right over that, and it allows it to both rotate and flex and extend. So this one's more rounded because of that. It helps you remember the head of the the radius attaches to the capitulum of the humerus. What do you call it when you cut someone's head off? A little French Revolution Day. Decapitate, right? So capitulum, capitis, head. We'll run into that capitis a bit too. The only other things I think on the humerus that we have are the tubercles. So we have the greater tubercle right here, the bigger one, the lesser tubercle right there, the smaller one, and in between the intertubercular sulcus. Oh, and on the head as well. So again, this is the articular surface that connects with the scapula. So right around here, where that articular surface ends, we call this the anatomical neck. And then this area right here where it gets narrower, right where I'm wrapping around there, that's the surgical neck of the humerus. So then we have our ulna and radius. I think the ulna is probably one of the easier bones to identify because it has this, see if I can get it to stay one way, has this really distinctive C-shaped hook on it. That's that trochlear notch. That's what anchors it onto the humerus with the coronoid process and olecranon process on either side. Now, next to the ulna, on the lateral part of your forearm, is the radius. And it's going to sit here, and it needs to move with your forearm as it rotates, or as it flexes and extends. But then when you pronate, or sort of like supinate here and pronate, or supinate, when you do this, your ulna doesn't move. So this has to roll across. And that creates this little notch that we have here called the radial notch. Then as we go down the ulna, we do have a head on the ulna as well. So the head on the radius is proximal, the head on the ulna is distal, and it has a styloid process that comes off the end. This little tiny nub that basically points towards your pinky. It helps you remember that. As far as left and right on the ulna, what you really want to figure out, so proximal distal is easy. Find the big trochlear notch, that's proximal, styloid process is distal. The anterior surface is the direction that the notch faces. So if this is like a mouth, it eats anteriorly. And then this radial notch right here, that has to be lateral, so because the radius is lateral. So if this is proximal, anterior, and lateral, this is going to be a left ulna as well. The radius, the head is on the proximal end. It looks like a suction cup. Like it's a weird little feature. Look at our term list, make sure we've got everything. Yeah, we only have a few things on this one. So if we follow down the radius, you'll find that it has a styloid process, a point on one end too. This points towards the thumb. And then for left and right, it's a little bit difficult with the radius, but basically you look at the distal end here, and one side of it is smooth, the other side has ridges. And if you feel the back of the radius on your own wrist, you usually even often see these, but you'll find grooves on it. So the grooved side, the side that has sulcuses, that's going to be the side that is posterior. So this radius sits like that. We know that the ulna would run right through this little ulnar notch right here. Here, this is the lateral bone, so this is a right radius. And then we get to the hand. We've got one that's a little articulated here, partially. Now, for the wrist bones, I don't ask that you identify them. They are on the term list, but you don't need to label them individually. As a group, we're just going to call these the carpals. And then for the feet, we'll do the same, although I do want you to know two of the tarsals in the feet. So I'll put a piece of tape here, and I'll ask, identify this bone, and you just have to tell me it's a carpal. Some people here have you learn the wrist bone, the carpal names, and the tarsal names. Some people don't. I don't. I've never been able to remember them, but I do ask that you do left and right, and so or at least on for the bonus questions. So that's where I kind of make that difference up. Once we get past the carpals, then we get into the metacarpals. And if you take a look at this, a lot of people confuse these for the phalanges. So look at how big my hand is. So my right hand to this hand. Imagine what somebody with a palm that was this big and fingers that were that long would look like. Bit weird, right? Almost all of the incorrect answers on these bones, people call them phalanges. And I know if I sat down with them and said, hey, does that look like a normal sized finger to you? And be like, no, it's got extra joints and it's way too long. So This is one of those ones where a lot of people just go too fast and slow down. But the meat of your palm is what we find the metacarpals supporting. Your phalanges, they start here. And we have, how many phalanges do you have in each finger?
3, except for the thumb.
Yeah, it's kind of a trick question. So you have 2 joints, so 3 bones in each phalange, except for phalange number 1, the thumb, where you only have 2. So we have a proximal distal in the thumb, or the pollex, and a proximal middle distal, or intermediate distal, in each of the phalanges. And the same will be true for your feet, too. The hallux, or big toe, has 2 phalanges, all the others have 3. All right, so go ahead and take some time with this, and then we'll do the lower appendicular skeleton at about 4:15.